Our second presenter is Shashank Sirsi from the University of Texas at Dallas. I had to make sure at Dallas. He's going to be talking about trying to get rid of, well, maybe not get rid of MRIs, but make them less dependent upon figuring out our blood oxygen level. I'm all for that. The less medical tests, the better. So welcome.
Great. Thank you very much. So the project I'm going to talk about today is on the development of hemoglobin microbubbles for blood oxygen level detection. So before this is really a proof of principle formulation study. Before I get into why we are doing this, we're making these bubbles, I'm going to talk a little bit about why. So monitoring blood oxygen levels is actually something very important. I think monitoring general health, disease progression, how patients respond to different therapies or different diseases. We're all pretty familiar with blood oxygen level detection sensors, mostly pulse oximetry, using optical methods of estimating blood saturation, oxygen blood saturation. So you've all probably seen pulse oximeters in a hospital or on your Fitbits or watches.
Can you stop for a second? Sorry, can you start over a little? Can you try to that mic is just being overly sensitive.
Sure.
Every time you do this, you're fine.
Okay.
But just can you keep your hand on the podium?
Hand on the podium.
There you go.
All right.
Perfect. You might want to start back up a little bit on your presentation.
Okay. Should I start at the beginning?
Nope. Right there is
Okay.
good.
Okay. So monitoring blood oxygen levels is actually very important for monitoring general health, monitoring disease progression, patient responses to different therapies or various diseases. And you're all probably familiar with different types of sensors for measuring blood oxygen levels. Pulse oximetry uses optical methods to estimate blood saturation, oxygen blood saturation. Even Fitbits and Apple Watches nowadays can continuously monitor blood oxygen levels throughout the day. However, most of these sensors are looking at global blood oxygen concentrations. And there's a lot of reasons that people would want to look at oxygen concentrations or metabolism in different areas specifically in the body. So the question is, how do we monitor regional blood oxygen concentrations instead of global? And this is where the term blood oxygen dependent or BOLD imaging comes into play. BOLD imaging is essentially, the most prevalent form of BOLD imaging is using MRI. MRI has very good spatial resolution and is able to detect blood oxygen concentrations using special techniques, specifically BOLD functional MRI or BOLD fMRI, which is rapidly growing in popularity. So this is a image of a BOLD MRI in the brain, looking at brain activity after a patient gets different stimuli. You can see when neurons are activating or deactivating. So it's a really cool emerging technique. However, there are a lot of problems with MRI, especially in a clinical setting. It's very costly. It has poor temporal resolution, and it's very subject to motion artifacts, so you have to stay very still or restrain a patient. There are other methods of looking at blood oxygen in different tissues using PET imaging. Again, costly, requires expensive radio tracers put into your body, and also optics or photoacoustics. These are very low-cost, rapid, but have very poor depth penetration into tissue. Our lab is actually more of an ultrasound lab, so we use a lot of ultrasound for medical applications. And ultrasound is a very commonly used imaging modality. It uses high-frequency sound waves in order to generate visual images. It's safe. It uses non-ionizing forms of energy, unlike X-ray or CT. It's portable. It's very small in size, and it's very low cost. Compared to a MRI scanning session, it's about tenfold less or cheaper. What our lab does is actually we generate ultrasound contrast agents. So these are actually known as microbubbles. And what these are they are gas-filled spheres. They're just small little spheres. So they're stabilized by lipid, protein, or polymer shells. And when you put them into the bloodstream, because they're about less than 10 microns in size, they'll circulate in the blood. So they're excellent blood pool contrast agents for perfusion imaging. The video here on my right is an image of microbubbles, these small little gas spheres, put into a bloodstream. This is a ultrasound image, standard B mode image on my left. that is looking at the liver of a pediatric patient after an infusion or during an infusion of these microbubbles. What you can see is them outlining the vasculature of the kidney. The problem statement is that with ultrasound imaging itself and ultrasound contrast agents, they're not capable of detecting oxygen levels. So that's what we're trying to do. We're trying to create a solution where we can create these microbubbles that are oxygen sensitive. In order to do this, we utilize hemoglobin, endogenous hemoglobin that's found in the body. Hemoglobin is the oxygen-carrying protein of blood and is composed of 4 protein chains. Importantly, when hemoglobin binds to oxygen, there's a structural conformational change. That conformational change changes the magnetic properties of hemoglobin, allowing it to be detected by MRI, and also the optical properties. Our hypothesis was that if we can make these bubbles out of hemoglobin, these structural changes would then translate into different acoustics. So essentially what we want to do is be able to listen to the blood oxygen levels. Really, this study is more about making these hemoglobin bubbles. I'm not going to go through the details of this right now, but we use an ultrasonic method, probe tip sonication, to generate these bubbles by emulsifying hemoglobin with air. And we can generate these small, less than 10 micron particles that have, these still have the ability to change their optical properties in the presence or absence of oxygen. So this is very important, that the hemoglobin in the bubbles are maintaining their functional ability to bind oxygen. The goal of this project is to listen to changes in acoustics in response to different oxygen levels. So what we did is we took a research-grade ultrasound scanner. We made a flow phantom. We put the bubbles in a deoxy or an oxy state. And unfortunately, the video does not show up here very well. But if you look at the raw data in each of these channels that we're flowing the bubbles through, what you're seeing is essentially the acoustic response. These bubbles oscillating or vibrating in a ultrasound field. What we can do is we do a fast Fourier transform. We look at the frequency domain, and we can calculate the amount of sound that is being generated as these bubbles pass through, depending on their oxy or deoxy state. So we have a very similar setup where we are taking bubbles in 100% oxygen solution. We're introducing a chemical, sodium dithionate, that reduces the oxygen levels, and we can track the change in the acoustic response, the amount of sound that is being generated with different levels of dissolved oxygen. So this is really a proof of principle study showing that we can generate these ultrasound sensitive agents that can respond very well to different oxygen levels. So this is definitely an in vitro study, but it opens the door to a new method of imaging that previously cannot be done with this modality. So ultrasound is very safe, it's fast, it's a low cost way of imaging the body. It's a great way of trying to do this, but there is going to be a lot of work still to go from listening to these bubbles in a flow phantom to eventually trying to look at oxygen concentrations in different tissues such as the brain. So, thank you very much. This is all the people that were involved, continue to be involved with this study, and thank you again.
Great presentation. It sounds like some great work going into figuring out what's going on inside of our body without really, a whole lot of machinery involved. A couple questions already coming in from the webcast are, how many microbubbles would you need for a typical measurement?
For a typical measurement in the body, we will actually, they're very sensitive. They're very sensitive to ultrasound scanners. So typically in a video such as this, you're putting about 1 million of these bubbles into the body. We still need to, there's a lot of attenuation. It's very easy to do this in a flow phantom. There's a lot of attenuation of sound that occurs in the body, so we still need to figure out what those concentrations would be. But it's very low. The amount of hemoglobin would be very low compared to the amount of hemoglobin that's endogenously in the body already.
Are there any side effects to putting the microbubbles in the bloodstream?
Yeah, that's a great question. So yes, so we're not there yet, but they do have to be engineered. We have to look at their circulation profiles. We have to engineer them in a way so that they are biocompatible. It turns out heme outside of the red blood cell is not the most biocompatible substance, but there are ways, and that other people have done and that we can do to modify the surface and make these more amenable for in vivo use.
Can the microbubbles be targeted to a specific area of the body, or do they just go everywhere?
When you inject them in the blood, they go everywhere. There are other people that do direct injections, so people can put these bubbles directly into an organ. That requires a physical injection into that organ. They do go everywhere. There are ultrasound techniques that you can use to cause them to accumulate more in different tissues. So that is possible. And there's also what's called molecular targeting, where you can put vascular epitopes or molecules on the surface that bind to different blood vessels and different organs. So that is all within the realm of possibility.
Last question, at least for now anyway. Could this approach be used to monitor white blood cell movement or concentration?
That's a great question. These are blood pool contrast agents, so they're essentially going where the blood goes. That's not really the application. There are other people, my lab hasn't done this, that can actually get white blood cells, macrophages, to engulf these microbubbles. And then using those kind of techniques, you can track those individual cells rather than whole blood movement. But
yeah, that question brought into my mind. I mean, do the microbubbles attract white blood cells because they think it's a foreign agent kind of?
Yeah, so that there is complement activation that is responsible for clearing these bubbles out of circulation. But there are, these bubbles have been used in the clinic for long periods of time. So there are methods of making them amenable to avoiding white blood cell or complement activation and white blood cell filtration.
Okay. Thank you so much for the presentation. Great topic. We'll probably see you back again next year.
Hopefully. All right. Thank you.
We're going to take a short break, and we've got 2 more presentations coming up, so don't go away.